Ever wondered why your mouth feels dry sometimes? Before we delve into that, let's appreciate the unsung hero of your mouth saliva. This unsung hero plays a pivotal role in your oral health. It's more than just a fluid. Saliva moistens food, clears away food particles, and eases swallowing. Plus, it's a natural defense against tooth decay thanks to the vital minerals like calcium and phosphate it contains. So having a well-lubricated mouth is more important than you might have thought. Now, imagine a scenario where your mouth fails to produce enough saliva. This condition, known as dry mouth or Xerostomia, can pose significant challenges. Saliva is our mouth's unsung hero, constantly working to keep our oral health in check. However, when its production dips, we encounter dry mouth. This is not just about feeling thirsty. It's about a constant parched sensation that can make everyday tasks like chewing, swallowing, and speaking more difficult than they should be. But the trouble is, don't stop there. With less saliva to wash away food particles and neutralize acids, your teeth are more exposed to decay. The lack of moisture also creates a breeding ground for bacteria and fungi, escalating the risk of oral infections. In essence, dry mouth is more than an uncomfortable inconvenience. It's a condition that can have severe implications for your oral health. And contrary to popular belief, dry mouth isn't just a part of getting older. But what causes dry mouth? Is it just about not drinking enough water? Well, the reasons are more diverse and complex than you might think. One of the primary culprits is the side effects of certain medications. Drugs used to treat conditions like high blood pressure and depression are known contributors to dry mouth. Medical conditions also play a role. For instance, Sjogren's syndrome, HIV, AIDS, and diabetes can lead to this uncomfortable condition. Furthermore, certain treatments like radiation therapy, particularly when directed to the head or neck, and certain chemotherapy drugs can reduce saliva production, causing dry mouth. Even nerve damage in the head or neck can affect the salivary gland's capacity to produce saliva. It's important to know, however, that dry mouth isn't a natural consequence of aging, but often a side effect of various health issues or their treatment. Understanding the cause is the first step towards effective treatment. Let's talk about how to recognize if you have dry mouth. The symptoms can be subtle yet disruptive. You might notice your mouth often feels dry and sticky. Chewing and swallowing become more of a challenge, and food may not taste as vibrant as it once did. Speaking might even feel uncomfortable, and there's the persistent bad breath that just doesn't seem to go away, no matter how much you brush or use mouthwash. If you're experiencing these symptoms, it's time to consult a healthcare professional. So you've noticed some symptoms. What next? Let's delve into the diagnostic process. It begins with a detailed review of your medical history. Your healthcare provider will assess your current medications, as some drugs can induce dry mouth. In some cases, blood tests may be conducted to rule out underlying medical conditions. Next, let's talk treatment. If medication is the culprit, your doctor might adjust the dosage or switching to a different drug. If your dry mouth is severe, prescription saliva substitutes may be recommended, but don't forget the power of self-care. Staying well hydrated is key. Regularly sipping on water can help keep your mouth moist. Chewing on sugarless gum can also stimulate saliva production. Avoiding irritants like tobacco and alcohol is another crucial step. And remember, self-care measures like staying hydrated and avoiding tobacco can go a long way in managing dry mouth. But let's not forget, prevention is better than cure. Just as we care for our general health, diligent oral care at home is paramount in preventing and managing dry mouth. Start with the basics, brushing twice a day and flossing daily. Use a fluoride toothpaste and a soft bristle toothbrush to protect your teeth from decay and your gums from inflammation. A dry mouth can be a breeding ground for bacteria, so consider using an alcohol-free mouthwash to maintain a fresh breath. Staying hydrated is equally crucial. Regular sips of water throughout the day can help keep your mouth moist. Chewing sugarless gum or sucking on sugarless candies can also stimulate saliva production. And don't forget to limit your intake of caffeine and alcohol, both of which can dry out your mouth. Regular dental checkups are an indispensable component of maintaining optimal oral health. They can catch issues early before they become severe. Remember, a healthy mouth is a cornerstone of overall well-being, so if you spot any signs of dry mouth, don't hesitate to seek professional help.